Welcome to our exploration of confirming pregnancy without a test. Today, we'll learn about the small hints and signals your body gives, helping us understand things in a special way without using the usual tests. Track your menstrual cycle. If you miss your period, pregnant people do not menstruate during the course of their pregnancies. Missing a period is usually the most obvious indicator that you're pregnant. Mark when your period starts and ends on a calendar. That way, you can see how frequent and long your cycle generally runs. Feel for swollen or painful breasts. Because of the hormones released in early pregnancy, you may notice some changes in your breasts. They may swell slightly or be somewhat sore to the touch. You may also notice that your breasts feel fuller or heavier. Your nipples may feel swollen, painful, or tingly. Look out for spotting. You may notice spottings of blood during implantation, or when the newly fertilized egg attaches itself to the wall of the uterus. Implantation usually happens within a week to a week and a half after conceiving. This symptom can last for about 3 months. Spotting is usually lighter in color than your menstrual blood. This type of implantation bleeding usually occurs around the time you would expect to have your period. Not everyone experiences spotting. Take note if you experience any cramping. These cramps often feel like the ones you experience during your period. However, if they're particularly intense and painful, or if you notice that they're just on one side of your body, it can be a sign of a complication. Monitor if you're feeling more fatigued than usual. Many people feel extremely tired in the early stages of pregnancy. This symptom is usually attributed to increased progesterone levels. You may notice this symptom as early as 1 week after conception. Pay attention to how often you urinate. Another early sign of pregnancy is frequent urination. When you become pregnant, your body produces more of the hormone human chorionic gonadotropin. This hormone, which is highest in the first few weeks of pregnancy, pushes more blood to your groin area, causing you to need to head to the bathroom more often. On the other hand, another possible sign of pregnancy is constipation. This can happen during any trimester of pregnancy, and it can appear as early as the 2nd month of pregnancy. Watch for moodiness and irritability. Pregnancy hormones can do a number on your moods, just like they do when you have your period. If you're feeling extra moody or irritable, it could be a sign you're pregnant. This symptom can appear 2 to 3 weeks after you conceive. Monitor for an increase in headaches. Sometimes, a headache is just a headache. However, an increase in headaches can be an early symptom of pregnancy due to hormonal changes in your body. Paying attention to other symptoms. Note if you have morning sickness or a frequent upset stomach. Morning sickness can strike early in a pregnancy. Despite its name, morning sickness doesn't just happen in the morning. You may have an upset stomach any time of day, and may also experience some vomiting. This symptom can strike as early as 2 weeks after conception. Be aware if certain smells or food start to bother you. A common symptom of pregnancy is developing a change in food preferences, or an overall decrease in appetite. You may start noticing you suddenly don't like certain foods or smells, even if you were totally fine with them the day before. You notice you're eating more than normal, and still find yourself hungry. You may be pregnant. Look out for a metallic taste in your mouth. This symptom is especially prevalent in the early stages of pregnancy. It's usually caused by a shift in hormones, and is typically harmless, just may be a bit unpleasant. Pay attention to any back pain. During pregnancy, the ligaments in your body become softer in preparation for the birth, which ends up putting some strain on your back. Therefore, it's normal to feel pain in your lower back or pelvic area when you're pregnant, especially in the early months. How soon can you take a pregnancy test? To get the most accurate result from a pregnancy test, it's recommended to wait until the first day of a missed period. Pregnancy tests detect a hormone called HCG, which is only present if you're pregnant. HCG appears around 6 days after a fertilized egg attaches to the uterus. But it takes 7 to 10 days for levels to be high enough for the test to detect. Taking a test too soon may lead to a false negative. If you have irregular periods and are unsure of when your period was due, waiting at least 21 days after unprotected sex improves the chances of an accurate result. The best time of day to take a pregnancy test. Taking a pregnancy test in the morning is usually better because your urine is more concentrated when you wake up. Pregnancy tests detect a hormone called human chorionic gonadotropin, and the concentration of this hormone is higher in the morning. So, if you take the test early in the day, especially before you've had a lot to drink, you're more likely to get an accurate result, especially if your period is not yet late or just a couple of days late. Thanks for tuning in. Don't forget to prioritize your health. Small steps today lead to a healthier tomorrow. Subscribe for more wellness tips.